I don't take nothing that a doctor don't prescribe. I just take Paxil, Xanax, Zoloft, Flomax, morphine, Valtrex, Flonase, Plavix, codeine, Zyrtec, Zoma, Zantac, Ultram, Zocor, Zipro, Prozac, dopamine, Demerol, Lexapro, Tylenol, Vicodin, Lyrica, Lipitor, and Adderall, but I don't do no drugs, man.
Everybody's Dr. Beard, and I'm joined by Anna Allen. We have another episode to bring you for our podcast, which still has no name, and we would love help with that. We are just struggling to come up with a catchy and clever name for a podcast that is really going after the young old contrast, the what I wish I knew then. Um, Perspective. So if you can help out, please help us out. But today's episode is very interesting. It will be interesting for women, of course, of all ages, I think, because the med spa services out there are endless. And there's a lot of these businesses everywhere, and everybody does has their own little niche, depending on their level of education and expertise, anywhere from, plastic surgeon practices and med spas, all the way down to people who are just, maybe doing facials and things like that inside of a salon. And so I have a lot of experience in this area. I've been the medical director for a few med spas over my career. My views on the services have changed, especially some of the more invasive types of procedures. And we're going to discuss kind of the pros and cons of these services, the things that you might want to consider, the alternatives, where you might want to spend your money versus some of these services, and really about the foundations of beauty and good skin and a great complexion and defying aging, right? Which is seems like most women are trying to do some, one way or another. So let's talk about these services, Anna.
Yeah, so
What's
I
first on
mean,
the list?
like you said, this is a huge industry that most people from my age to your age have had some kind of experience with or encounter with. I was doing some research before this and I found out that this is a $15 billion industry. So, like you said, a lot of our money is being poured into med spas. And so I think it's important that we talk about this and all the
Mhm.
things that come along with that and where should you be spending your money and should it be into these things? And so I think that talking about, the pros and cons of that is going to be really helpful for not only my generation, my age group, but for anywhere in between. And so to start, let's talk
Yeah.
about injectables and fillers.
Okay. Yeah. And before I talk about these, just I want to make sure that if there's any young people listening, what you do now is going to impact your skin 10 years, 20 years, 30 years down the road. So, you really want to start paying attention to what you're doing to your body and what you're exposing yourself to if you want to have great looking skin, when you're older, which is absolutely possible. Okay, and you don't have to spend a fortune doing it. So, um, let's talk about fillers. I have had fillers. I do not get them anymore, but I have had them injected into my face, marionette lines right here. That's one of the most common places women will get them. They also put them, here if you have deep wrinkles there. If Botox didn't do it, they can put in fillers there and sometimes around your lips. And of course, in your lips, right? We've got the lip fillers too. And the problem I have with these, this is something I experienced, but there are case reports of the fillers causing autoimmune exacerbations. And they are often um, you often see symptoms months later, not right after you have them injected, which comes with its own risks. Just, you can have infections and things like that that can pop up. You can have these little nodules if they don't go deep enough into the skin. They're too superficial and they can be, like that's not a good look to have little nodules on your face. But there are several case reports that uh, that showed women having autoimmune exacerbations, 10 months later down the road. And it's hard to make that connection, right? When it happens so far away from the time that it happened. But there was one case that I was reviewing that showed that the fillers had called a delayed onset granulomatous inflammatory reaction. This patient had come in, she had a known autoimmunity problem. She had been getting fillers for 14 years on a regular basis. So probably the amount that she was exposed to also probably played a role. But she developed lymphadenopathy around her face. So her lymph nodes were swollen behind her ears, around her jawline. She was having joint pain at the same time. And then her face, she was having these large nodules pop up on her face at the where the filler was injected. And they had tried multiple things um, to help the situation, from antibiotics to the to the compound that helps break down the hyaluronic acid that they're injecting that's part of the filler. That didn't work. So it was just this inflammatory immune process that had developed in this lady. And eventually it subsided, but it took a long time. And they advised her never to get any more fillers. And what some of these researchers have found is that there's an increased risk when when you've used different fillers. So there's different companies that are offering fillers, and they, may have their own spin of it's supposed to be pure hyaluronic acid. Okay. Now, pure hyaluronic acid is present in basically all species, bacteria and mammals. And it's basically considered um, immunologically inert. So it's not supposed to cause a reaction. Now, it will when you're injecting it into your skin. It pulls water into it. It does cause that initial inflammatory response because it's a micro trauma. You're injecting something into your face. So the body's immune system is going to do what it's supposed to do when something has broken the skin, right? So it's pulling in fluid and cells and collagen and things like that. But, you know, it's I I I don't trust the pharmaceutical companies. Are they really, is this really just nothing but hyaluronic acid, or is there something else in there? And I meant to look up the package insert for these, and I think I have in the past. And it was basically that's what it was. They didn't list anything else. Okay, they didn't list anything else. But these people have been caught lying on multiple occasions in the past about what was in their products.
Right.
So,
And
and
I'm sure a lot of these med spas, I think where you probably get into the most trouble is having people open med spas who aren't well equipped or do not have the knowledge they need to perform these services in the correct manner or with the correct products. And so you will probably run into these companies that are offering cheaper services. And it's probably, I mean, you correct me if I'm wrong, but probably those cheaper services that you may run into some more of those issues. Is that correct?
you know, um, the person who's injecting you, of course, experience matters, right? There's a lot to know. I've gone to these courses. I took a course on these aesthetic procedures as a physician, And so, you know, attending a conference where you're taught how to do it is very different than actually going back to your office and doing it correctly. Experience is huge. Like you want somebody who's done this a lot, so that they're injecting it correctly and considering a lot of the other things that you have to consider before you start putting the stuff into people's faces. But it's still, for me, it still comes down to the product itself and the fact that we know it's causing autoimmune exacerbations in people. So, and there's a lot there's probably a lot of other mediating factors for that. And of course, the case that I stumbled upon that really drove home the point, this, like I said, this lady had been doing this for 14 years. So I imagine the length and duration and the number of times you've done this is probably playing a role too. And also, people who have autoimmune diseases are often on immune modulating medications, so that are suppressing certain arms of the immune system and certain immune responses. And so how is that playing into the response that can occur when using some of these dermal fillers? Don't know.
Yeah,
Has that even really been researched? I highly doubt it.
yeah. What are some of those immune modulating medications that you've
Oh,
really seen?
goodness. I mean, just, methotrexate, sulfasalazine, all the latest and greatest. Um, I mean, they're coming out with new ones all the time. Just turn on the TV, and it's going to be a new drug for an autoimmune condition. Seriously.
Yeah.
MS, that's the big one is MS, Crohn's disease. That those patients are often being advised to take these immune modulating drugs. And I mean, how is that reacting with some of these fillers? And
Right.
the response, the immune response to the fillers.
Yeah.
So,
Are they taking a whole body approach, when they're going
no.
into the office? Are they getting this history of?
No, no, they're not. No, no. I mean, you're asking people like, have you had aspirin or omega-3 fatty acids, in the last 4 or 5 days, or do you have any known allergies and things like that? But it's the history is very, not a lot there, not a lot to consider. But and I don't know if there will ever be really research on this. I mean, it's a big money maker, so I don't know if people want to expose themselves or not.
Yeah.
So, if there was a lot of money involved with exposing it, then you bet the research would be there, but follow the money and
Yeah.
there's where you find your
Yeah.
research.
There's definitely a lack of research out there, but the research that is available is the short-term symptoms of, Botox and fillers. So you
Right.
you can research that all day of, what
Oh
happens
yeah.
immediately, and you might get symptoms like headache or redness or swelling, all
Yes.
these things, the
Hmm.
immediate responses, but then past that, it's like the research disappears.
Oh yeah. It's always like that. It's always what can happen in that initial 12 to 24, 36 hour period. And that's where it stops. Nothing is ever followed, long term for a lot of things, not just, aesthetic products.
Yeah. Yeah, moving up maybe towards something that might be a little bit better. What are your thoughts on lasers and laser therapy in med spas?
I'm a fan of lasers. I have had some laser treatments over the course of my life. I think the first one I had was when I was in my early 30s, and I had melasma, which is the discoloration of your skin. Often when it can occur often when women are on birth control and have a lot of sun exposure, you can develop this patchy dark areas on typically the lower portion of your face. And I had that, and I was on birth control at the time. And I also had some superficial vessels on my face just from sun damage because I lived in the sun and didn't really think about wearing hats or anything like that. I was just out there burning my skin as a young person, thinking that hoping that it would turn into a tan, which it never really did. I just walked around with a red face all the time. Um, but I used a laser, and this was when the laser technology, I mean, this was new then. It's come a long, long way since then, but it was remarkable at what it did. It got rid of the dark spots with like one treatment. It was gone.
Wow.
And same way with the superficial vessels that were on my cheeks from the sun damage. I mean, a couple of pops there with that laser, and boom, it was gone. And it stayed away. So long as I didn't burn have a lot of that sun exposure again. But the melasma, of course, is going to come back if you're going to keep taking birth control. And that's what it did. And so I'd go back a year later and have the procedure done again. And then eventually I got off of birth control and it stopped. It didn't come back. But that was my first introduction to lasers. And I was amazed. I also had laser therapy done to remove a terrible, terrible tattoo that I got. I was a different person back then. Um, so I had this terrible tattoo placed in my 20s. Like I don't think I put any forethought at all into what I was having, tattooed on myself, but I hated it. And I used laser therapy to have it removed, and it did a great job. It was very painful. The lasers are painful. They will often put some numbing cream and gel on your face. And now it was the lasers they have today are I think less painful, and they have better ways of dealing with that. But back then it was just like grit your teeth and get through it. Especially anything around the mouth and the nose was like it's so painful. But they numbed my back. They numbed the area that was on my back before they did the laser therapy for the tattoo. And that was the worst. I mean, that was like all these tiny injections because it was not a small tattoo.
Yeah.
And but it's you can still see that there was something there, but it got rid of all the color, but it left pretty much a scar.
Yeah.
And I think the newer lasers aren't so scarring. But it also depends on the color of your tattoo too, of like what um, laser that they have to use to eliminate it. And I had a lot of green, which I heard was like the worst.
That's interesting. It's
Like,
the
yay! I picked the
color.
worst color to have removed. And
Color.
it's expensive. It was a lot more expensive than the tattoo, I can assure
Yeah.
you.
Wow.
It was over 2 grand to have that removed.
Wow.
And it's still you could still see that, it was
Still
there.
somewhat there.
Anyway, live and learn,
Yeah.
okay? And
Yeah.
that's why I will not get another tattoo. I'm
That's why
not
we're
gonna.
here, right? That's why we're here.
Yeah,
You
exactly.
share.
Yeah. Yeah. Because what looks cool when you're 21, I promise, is not going to look cool when you're 40
Yeah.
or even 30, because you will change a lot over your 20s. And I looked back and I was like, oh, I am so embarrassed of like, what were you thinking? You weren't thinking, weren't. So anyway, I have had laser procedures done within the last 5 years, again, dealing with mostly the effects of sun damage from a lot of sun. I've gotten a lot better about wearing hats, and most of the damage occurred in Colorado. High altitudes, the sun is so intense. I mean, 15 minutes without a hat on, and my face is going to be red. And so I'm much more diligent about wearing hats outside now. I've got a ton of hats. Like my hat collection is huge. And and so now that I'm wearing hats, I don't have to have these lasers done all the time, but it's nice to have because the lasers can do a great job of helping with redness, rosacea, dark spots, age spots, and some types of lasers can even help with wrinkles, which is great. Now you can get the very there are lasers that can go really, really deep into your skin, and do a great job at resolving deep wrinkles, but you have to go under for that. And those are typically done by plastic surgeons. You're under anesthesia, and there's significant downtime with those deeper lasers. But the results are fabulous. Like 3 months down the road, and it's like the before and afters are incredible. I was talking to a plastic surgeon probably about a year and a half ago, and because we were talking about the possibility of me doing this at some point, should all the other stuff that I want to do, the natural stuff, not do as what I wanted to. But he was looking at me, he's like, Amy, your face is fine. What are you even in? Why are you even here? And I was like, just super critical, right? We're in the mirror, we're looking at our face, we're seeing all these wrinkles that we didn't see, 5 years ago. And I think we're our own worst critic. My husband looks at me, he's like, I don't even know what you're talking about. But I'm like, look. And he's like, you're Paul's really good. He's just like, I see you as this beautiful girl that I saw, met 12 years ago. You're still I still see you that same way. And I'm like, well, that's good. But the plastic surgeon we were talking about lasers, and he was saying how far they've come and how much they can do now. Like, if people don't want all the injectables and the Botox and the plastic surgery, lasers can help you out with that.
Wow.
And and I'm thinking about the pros and cons, and this is something that you have to consider. So lasers aren't, all free of harm. I do think they are probably a better alternative versus fillers and Botox, because those things have to be injected on a regular basis. You know, the laser treatments tend to last a whole lot longer. But the thing you have to consider with lasers and anything that you're injecting into your skin is it's causing what we call micro traumas. And so, anytime there's a quote a trauma to the skin, the immune system responds like it's supposed to. It's supposed to come in there, bring these cells to wherever the trauma occurred to patch things up and to heal it. And if you're doing that on a regular basis, um, then this can cause the immune system to kind of always be in overdrive, especially if you're doing it, like I said, on a regular basis. And then, of course, the laser treatments are like a one and done. So you're getting micro traumas, you're getting trauma to the face, but you're done for several years.
Mhm.
Unlike the other stuff where you're constantly, like microneedling, you're making it's tiny injections, tiny little injections, but those are considered micro traumas. So
Right.
it's just something to consider. We had this discussion at an IFM conference several years ago, and I really had never thought about it, but someone had a session talking about micro traumas, and they were talking about aesthetic procedures in particular, and kind of, and repeated surgeries and what this was doing to the body and the immune response that it was causing. So anyway,
Yeah.
that's not ever brought up hardly.
Right. And it's something to consider of what other areas in your life are causing immune responses as well. And this,
Right.
some cases might seem very small of a decision, or you're like, oh, it's hardly doing anything. But if there is a lot of immune response going on
Right.
in other areas of your life, that's something that they don't talk about and they don't consider. But it's great to know and hear your thoughts on these other options. Then,
Well, and it's the they sell the immune response because it's the immune response that's causing the effects. So the stuff that you're putting into your face, or the needles, and it's causing an immune response, and that immune response is desirable at that time to produce the results.
Right.
But so it's that short term um, mindset that people are kind of hooked on, like, oh, yes, we use your body's own immune response to do this, and it's great. And I'm like, yeah, but if you do that repeatedly, it's probably not so good.
Right. Yeah. You have to think about the long term.
Yes, you do. And we're, there's not a lot of that going on these days, you
Yeah.
know?
Yeah, it's that instant gratification that most people are desiring, and ultimately why these industries are out there is because, we all have that desire to look and be a certain way and fit in a certain.
Oh, I know. That's a whole other topic, right? It's like, why are women not allowing themselves to grow old gracefully?
Yeah.
Why are you not letting yourself age? You're 50. Why do you're not you're spending a fortune and killing yourself trying to look like you're 20? And why would you why is that? And of course, we're inundated, women are especially, and I think men too, of just these advertisements for all types of, beauty regimens and workout routines and the latest collagen powder to help your skin and the frownies, the things that you put on your forehead to help with the wrinkles instead of Botox. There's so much, like you said, it's a huge industry. And then of course the images on social media from of celebrities that are all photoshopped,
Yeah.
all of them. Anything on the magazine cover, or these people have had so much work done to the image. It's not them. Okay, their skin is not porcelain like that in real life. And so I just think there's a lot of fraud occurring, and there's people have unrealistic expectations based off of Photoshop. So I was talking to Paul last night about what we were going to talk about today. And of course, without fail, Facebook heard it and, pulled up a podcast where I think it was Beth Ann Stuckey, maybe. I don't know if you know that name. She has a podcast, and I'm not sure what it is, but she had a plastic surgeon on, and that he was guessing the ages of these women and kind of critiquing them of what they probably had done, fillers and Botox and what have you. And he would guess their age, and he was guessing their ages from anywhere between like mid 30s to early 40s. And these women were in their 20s. The take home was like, are these procedures actually making women look older? So you have
Right.
someone who's in their 20s, prime, like this is the prime of your youth. This is when your face, you're through the acne years of teenage, the teenage years. You've got all that wonderful collagen and elasticity, and this is when you shine.
Right.
But they're having all these 20-year-olds are having like procedures done. And it's just crazy to me to think that they would do that. And it's actually making them look older.
Yeah. I mean, that's
So,
That's an interesting point that I feel like most people, young people, don't hear because the media is filling their minds with this will make you look younger. This is the magic recipe to solve all your worries about getting wrinkles one day, even though their skin looks flawless. And I've seen this in my
right?
life, friends that I'm around of, people who just have flawless skin, no wrinkles. Like you said, they're in their prime, and for skin health at least, and yet they are like, I need to go and get this injection. I need to go start now because all these things are telling me
Yes, start
start
now, right?
start
Prevent.
now.
Yeah,
Yes.
and that's how they're selling Botox, is preventing wrinkles.
Right.
So go ahead and start getting your forehead injected and and around your eyes to prevent the wrinkles from forming.
Yeah.
Um,
And
and, and yeah, and the research that's coming back on Botox is not good. It is this stuff, whatever's in this stuff, we know it's botulinum toxin, right? So that paralyzes the muscles, and that's what gives the effect. But it's crossing the blood-brain barrier. Not good. And we know it is causing autoimmune exacerbations.
Yeah, and
Again,
well, one of
months down the road.
yeah, and all those things are those autoimmune conditions are just increasing, increasing, and increasing, especially in a younger generation. And we're left with why. There's no reason why, but some of these things aren't talked about. Of,
No.
what else are you doing to your health? What else are you consuming?
And I will say this is one area too where women don't want to tell you. Like I have to pull it out of them, because on our intakes we ask about surgeries and procedures, and those never, I don't know if they don't ever, it just doesn't, they don't consider it as something like a major surgery or procedure. But I have to not, I started asking about this, like, do you have breast implants, tattoos? Do you get Botox? Do you get fillers? Because we need to know because we know that it is modulating the immune system and
Mhm.
not in a good way.
Right. Yeah.
So, and then of course the women just don't want to hear that. You're like, "Then what am I gonna do? I've got these wrinkles and I've got this bad skin and blah blah blah." Well, there's things that you can do, which we're going to talk about.
Yeah.
So,
And
what other services? Let's see here.
light therapy.
Botox, fillers, laser therapy, infrared.
Infrared, light therapy, saunas, you could bring up that into a lot of these places are, talking about infrared,
Yep.
infrared light, blue light, red light.
Which I like, which I feel is a pretty safe thing. Um, I've I've got one of the red light boxes that have a combination. You can do red and blue light. Um, and then I bought one of the face masks too that you could wear around the house. And I'll tell you, the I feel like I saw results pretty quickly
Mhm.
when I was using this. Um, it works at the mod and different the for depending on how close you are to the light, it can produce different results. And so when I was using the distance to really help with fine wrinkles and texture, I I had used it for about a week, like every day, 30 minutes for every day for a week, and I could tell within that short amount of time uh the fine wrinkles had gone and the my face was tighter, and so these lights are really working at the mitochondrial level, and so it's hard to go further upstream than that. So I'm a big fan of the red light therapy. Not we know it helps with skin. That's why so many aesthetic med spas have these, right, as services and products because they work and they get results. They're just not instantaneous. And I
Mhm.
do think there are several uh, consumer grade uh, boxes and lighting systems that are pretty good value for what they can do.
Right. And I think
So,
you made a good point about the consistency part of red light therapy because some of these services that I've run into, like facials plus red light therapy. And they give you a facial and then you're paying an extra fee for red light therapy that they might be doing for 5 to 10 minutes, and then you're not doing it ever again. So
right.
could you kind of
That's
speak?
not really doing anything.
Right, right. Of like red light therapy can be extremely beneficial for your skin if used in a consistent manner.
Right.
But how often is it consistent when you are doing it from a service like this?
Right. And I'll also say this about the red light therapy. A lot of people use it for pain relief. You can put it on certain joint areas or areas where there's pain, and people have reported really good success with that. Hair growth, they have reported like increased hair growth on their scalp from using this therapy. We know it helps people detox. I noticed that when I would lay underneath my red light box, I would always fall asleep, and a lot of people were using it to to help them fall asleep at night. That's when they would do it. They would choose to do it right before they would go to bed because it would help them get sleepy, and then they would tend to fall asleep better. And so I was like, that is very interesting. That's why I bought it. Because
Yeah.
when I was having all that insomnia, I was like, well, let me try this. People are saying it helps with sleep, so I got it. But it really wasn't helping my sleep, but my skin was like, wow, what is going on here? And so I didn't even buy it for that, but it was pretty wild what it did. So yeah, I'm a big thumbs up for
Okay.
the red light
Good
boxes
to
out
know.
there. Yeah,
Red light therapy.
absolutely.
It
Uh-huh.
is worth it.
Yes, I think it's definitely worth it. It's an investment, but there are you just kind of got to do your research. I bought the Biomax 900, and I had done a lot of research into various companies, and I felt like that was by far the best value out there, and I still feel that way today.
Yeah.
I did buy a mask for like $300, and it stopped working in like 10 uses. Don't know what, it's not charging. So not sure what's going on there. So, but again, when I was wearing the mask, it was still doing the same thing. I could tell it was really helping with the skin. And if you have a mask on, you can walk around the house and stuff, but you really can't because it's not, you've got some eye holes there in the mask, but you're still stumbling around on stuff because you
Right.
can't. So you still need to sit down when you're using it.
I've seen people on social media with their red light mask on going for walks outside.
Okay,
And
that's scary. Come
I'm like,
on.
that's a little bit scary.
I'll lend it to somebody for they want to have it for their Halloween costume or
Right.
something.
Yeah.
That would get some scares, some tricks. Um, yeah, so again, I don't know what happened to my mask, but I've got to talk to the company and see what we might can do about that.
Yeah. Well, other therapies or other services that are offered, laser hair removal, dermaplaning, uh,
Yeah.
what are your thoughts on those?
No, I understand why some people have laser hair removal. I not a hairy person, I don't. But I will say if you have, especially women who have thick hair on their face, there's something going on. Okay. Usually there's definitely some hormonal issues, hyperinsulinemia, insulin resistance issues. And so that needs to be addressed, especially if that is where you find yourself, like with dark, coarse hair on your face, which I think is some women get the laser hair removal for that. Um, and I get it. Who wants to walk around with, a beard on their face when you're a woman? Nobody wants that. If you, but if that is occurring, we've got some metabolic issues that need to be addressed. Because I promise you, hair growth on your face is the least of your concerns. Okay, so that's just a big red flag. I see women who are getting laser hair removal for like their entire leg, and I'm like, I don't know. I think we kind of need hair. I mean, we were born with hair. God designed us that way, so I don't think getting rid of it all is probably the best thing to do. Maybe just shave it, which I hate shaving. I don't know if I dread it. I do not like it. I am so glad when like winter comes around because I'm like, I don't have to shave my legs nearly as much. But I just think laser hair removal therapy can become extreme with some women.
Yeah.
Uh, and again, we have hair on our legs and arms for a reason. So, removing that with a laser, I don't know if that is probably the smartest thing to do.
Yeah, and like
Um,
you said, there's when you are having excess of something and you're having that big of an issue, there might be something metabolically going wrong.
right.
I think for all of these things, there's things that you can be doing now, which I'm sure are listeners are probably really excited to hear about
Yeah.
all of those things, for someone who's like, these things that you're saying, they sound awesome, red light therapy, lasers. I want to do that, but I can't at this time, or maybe they are young, or whatever the case is, or maybe they've been getting Botox, but they're like, now that I've seen this, I want to move in a different
Right.
direction. So what are some of those things that they can be doing now that may have better or similar effects?
Yeah. So a lot of this is should be common sense, right? Is um avoid burning. Don't burn your skin. Really be diligent about um wearing hats, in the summertime if you're outside when the sun is at its highest and it's most intense, just put a hat on. And a trucker hat's not going to cut it because you're still the sun's still getting so get you a wide brimmed hat. It's okay. There's a lot of cute hats out there. Um, and so that's my number one thing right there is just protect. Do not burn your skin. Um, the other one, the other things, um, what the inside, your skin is a reflection of what's going on inside your body. Okay, and if you have bad skin, whether it's acne, rosacea, the texture's bad, a lot of wrinkles, it's dry, all is not well inside you. Okay. And so that you need to address that not just for the sake of your skin, but the skin is just a symptom. So if all is not well in your body, there's going to be other symptoms besides just your skin. And so gut health, I mean, right there is like so important. In fact, we have a lot of people who come to us with rosacea, acne, and just dull looking skin. And after we have, uncovered and addressed a lot of their root cause issues and their gut health, their skin improves. Almost always. And sometimes that people didn't even come to us with, the objective of improving their skin, but they comment on it. Like my skin looks so much better. So, your gut health, and we've said this in the past, is your gut health is your immune system. So if it's not happy, the rest of your body is not going to be happy. And lots of times that gets expressed as skin issues. And so you've got to make sure that you're putting high quality foods into your body. Don't skimp on animal protein. Don't. Women are just not getting enough high quality animal protein, or they're eating like chicken all the time. Chicken's probably not the best animal protein. Red meat, eggs, high in the fats, like the really high quality fats. Please do not be afraid of fat. Your skin loves fats. Where, it's a high quality grass-fed butter, avocado, coconut oil, olive oil. All those things are so good for your gut health, which is going to be great for your skin. And you just have to make sure that you're digesting well, because what you don't digest, you don't absorb. And so you've got to make sure you've got all the nutrients there to regenerate skin cells. And so that regeneration and turnover happens quickly in the skin. And so you want to make sure that, you're getting all the nutrients that you need to do that. And some of the ones that really play a big role are, vitamin C. Okay, that's a no-brainer for collagen. There are, just bone broth. I could go on and on about how bone broth can improve your skin, but it's working inside out. So bone broth is great for gut health, and we used to include bone broth as part of our gut. It was basically part of our weight loss program, but we focused a lot on gut health because that's where we saw the most results. And we were including this bone broth that had a lot of love put into it, and the women were just ecstatic over what it was doing for their face. They were like, it's just their faces were glowing. They looked so good. So what you eat matters greatly. And the other things are alcohol. If you want bad skin, drink a bunch of booze. Smoke cigarettes. you will have bad skin. Don't prioritize sleep. I mean, you got to have sleep. That's when you sleep, that's when your body takes out the trash. So if you're not getting good, deep, adequate restorative sleep, your body is all you're just accumulating trash in your body. And when you have too much trash, your skin is going to show that. So please prioritize sleep. Sweating is great, helping you detox. Um, and it just helps, I think, people who work out and get their sweat on are detoxifying, and that's going to always help, your skin too. It's really all coming down to the foundations, right? Um, have we left out any, Anna? As I sit here,
No, I think you did a great job. I think you're right. I think it comes down to the foundation.
it's simple. It doesn't have to be difficult and expensive. Now,
Mhm.
you are going to pay more money for better food, but it's going to save you money in the long run.
Right.
So good food, good high quality food is an investment, and I feel like it has a huge, huge payoff. So that's if I had known what I know now when I was your age, I would have been doing all of those things.
Yeah.
And
And
I would not have had to spend the money that have had to spend, on
yeah.
all the procedures and stuff like that.
And it sounds silly. It sounds simple to say, just do the basics, just do the things. But that's really where you've seen the most results in people and patients
Yes.
in your own life and yourself. So I think that's huge. And those are things that are easy to place into your routines, into your habits, into your lives. So one thing that, I would want to ask if as you're talking to someone, whether they're in their 20s, 30s, just looking for those practical action steps, if they're like, okay, I want to move away from some of these services that I've been pursuing, that I've been seeing, what would you say are 3 action steps or goals that they can make in the
Wow.
next week or month to improve their skin, um, and their
Yeah. So, um, one that comes to mind instantly, of course, is don't burn your skin. Avoid avoid sunburns. And sometimes um, that's going to mean you wearing a wide brimmed hat. And excuse me for my voice. I just had a coughing fit. Um, so they've got a lot of cute big hats out there. So just get used to wearing them because I don't want you using toxic sunscreen on your face either, because that's not helping. In fact, that stuff always just breaks my skin out every time I would put it on. So avoid burning your skin. I mean, really take that to heart. Just don't let it happen. A trucker cap is not going to protect your face. You're going to have to use the water brimmed hats. Another thing, and this is so important, is gut health, which should not come as a surprise if you've heard our other podcasts and know anything about me. But your GI tract is a huge part of your immune system. So if it's not happy, the rest of your body's not going to be happy, including your skin. And lots of times people come to us with skin issues, whether it's rosacea, acne, just aging, dull skin. And, they've got usually have other problems going on, right? And so we will address their gut health and boom, everything resolves. And they're just amazed at how something like addressing gut health has such dramatic effects on their skin. And I mean, when we had a weight loss program, we were very heavily focused on gut health because, of course, a lot of your weight issues are tied into gut health. And we were using bone broth at the time to help with gut health. And man, it just, wow, you talk about glowing skin. The women were so angry when we stopped doing that. They just wanted a continuous supply of that bone broth because they were loving what it was doing for their gut health and their skin. Of course, the bone broth has a lot of collagen and things in it, which is fantastic for skin health. But what you eat plays a huge role in in the texture and quality of your skin. So really take that to heart. Most women are not eating enough high quality animal protein or high quality fats because we've been programmed to think fats are bad. Got to stay away from them because they're going to make me fat. And they do just the opposite. You need high quality fats for good skin and for good gut health. And a lot of women, they say they're eating a lot of animal protein, but it's like chicken. Like if that's like the worst. I mean, it's not. It is protein, but it's not a high. It's not a nutrient dense animal protein. You'd be much better off eating high quality grass fed beef and eggs and pasture raised eggs. Eggs have a lot of bang for the buck. I'd much rather you eat the egg than the chicken meat. So more animal protein, better fats. Get rid of the sugar. The sugar is causing a lot of havoc on your face. If you want to age prematurely and have a bunch of zits and bad gut health, just eat a bunch of sugar and simple carbs because that's what's going to happen. So pay attention to your gut health. Wear the don't burn. Get good sleep. I know you're young and you feel like you can get away with not, getting all the sleep that you need because you're young and you can do that. But when you sleep, that's when your body takes out the trash. So if you're not getting adequate restorative deep sleep, your body is not taking out the trash. So it's accumulating. And when the trash is accumulating, you do not detoxify well. And that is going to show up in your skin and other places. Okay, so prioritize sleep. You need the sun, okay, but just protect yourself from burning. Don't avoid it. You need the sun. The sun is great, does a lot of good things for you. Get good sleep, work out, sweat. Sweating is another way that we detoxify. And exercise is a great way to keep that skin looking young too. Okay. And it's doing a lot of other things besides, just helping with skin, the look of your skin. Okay. Because it's what it's doing for the body. So what's good for the body is going to be good for the skin. What's good for the heart is good for the skin. What's good for the brain is good for the skin. Okay. It's all connected. Have I left anything out, Anna?
You have covered it all, but if someone wants to go more in depth into those topics, and really uncover, the foundations, how can I practically be doing these things every day? Um, what can that person do? And also, what can the person do who's like, I know my skin struggles, I know the symptoms that I'm having are connected to my gut, but I'm doing all the foundations. What can they do as well?
So you've got some options. So the first is in lieu of becoming a patient, I recommend the Live Well course and planner. This covers all the foundations. And we've had a lot of people who have used this 3-month course and planner and have just given us rave reviews like this. It got rid of so many of their issues, and some of them are skin issues. Okay, so that's a great place to start. It's a great value without having to, become a patient. But if you feel, if you want to become a patient and you want to work with someone just one-on-one, you can always do that, right? We have a lot of expertise in this area. We've helped a lot of people of various ages, female and male, overcome skin issues. The other thing that you might want to consider is our Total Gut Job program. So this is basically a intense gut rehab program that includes an elimination and reintroduction diet because you need to know if you have food sensitivities. Because I will tell you right now, food sensitivities were driving a lot of my skin issues when I was younger and didn't know. Gluten was a big one. Face was breaking out all the time, and it was primarily because of gluten and sugar. And now I know that. And so you've got some options. Total Gut Job, you can go online and purchase that. We've had this program out for a long time, and it's helped hundreds and hundreds of people. The Live Well Planner can also be purchased online, which I'm very, very proud of that. We worked on that course and planner for a long time. And then of course you can schedule an exploratory call to see if you are a good fit to become a new patient. So there's your options. But if you got skin issues, I promise you, we can help you in some way. Okay, whether it's the Live Well Planner, Total Gut Job, or just working one-on-one with us.
That's great. Well,
Did I forget anything? I think
no,
that's, yeah.
yeah, thank you for your feedback, and we will link those, both of those, the Total Gut Job and Live Well, in the show notes. And so, if you don't know how to get there, there will be a place for that in the show notes.
Yes. All right. Well, that was fun. I hope you learned some things, and I hope that you will heavily reconsider some of the procedures and services that we discussed today, because they may produce desirable short-term effects, but you better be thinking more long-term, because it could come back and bite you in the backside. All right, we'll talk to you soon.
I don't take nothing that a doctor don't prescribe. I just take Paxil, Xanax, Zoloft, Flomax, morphine, Valtrex, Flonase, Plavix, codeine, Zyrtec, Zoma, Zantac, Ultram, Zocor, Zipro, Prozac, dopamine, Demerol, Lexapro, Tylenol.